We are going to go ahead and get started. Thank you all for joining today. Welcome to the Michigan Overdose Prevention Coalition, or MOPC's quarterly webinar. And again, thank you all for joining. The MOPC is a group of community members, advocates, and service providers who care about preventing overdoses through education and advocacy on harm reduction. Each quarter, the coalition provides an educational opportunity like today's, where people can learn about overdose prevention strategies and the ways that communities across and outside of Michigan are implementing those strategies. My name is Mary Emery, and I'm with Public Sector Consultants. We're a nonpartisan policy and research firm based in Lansing. I'll be moderating today's panel on behalf of the MOPC, and we are here today with my colleague Misty Elliott as well, who will be providing moderation support throughout the webinar. Today's panel is focused on law enforcement, a key partner in the overdose prevention and response system. We have brought together a great panel representing two different law enforcement agencies to talk about how their departments respond to substance use and overdoses, as well as harm reduction practices they use. We will have time for Q&A at the end of the session. When that time comes, please put any questions in the chat for my team and I, or feel comfortable to raise your hand so we can take you off mute to ask your questions directly to the panelists. We ask that all questions be respectful of our panelists and to individuals with lived or living experience with drug use and overdose. And with that being said, let's get started. So as I mentioned, we have two panelists today. Thank you both for joining. First, I'll just ask you both to introduce yourself and please share who you are, your role in law enforcement, and the community you're representing today. And Sheriff Goodenough, I'll start with you.
Well, good afternoon, and thank you for having me. I'm Trey Goodenough. I'm the sheriff here in Monroe County, Michigan. I have over 3.5 decades of service in law enforcement here at the sheriff's office, and I assumed the role as sheriff on January 1st of 2021.
Thank you. And Detective Yoder.
All right, is my audio working? I apologize. All right.
Yep.
I'm Detective Brian Yoder with the Franklin County Sheriff's Office, specifically our HOPE Task Force, the Heroin Overdose Prevention and Education Task Force out of Columbus, Ohio.
Thank you both. So I will just go back and forth between both of you, but I ask that both of you can provide any answers that you feel comfortable sharing to the next list of questions we have. So first, can you please tell us a little bit more about how overdoses have impacted your communities? And Detective Yoder, I'll start with you for this one.
Yep, so obviously overdoses have impacted our community, starting with, the opioid crisis and the heroin epidemic, causing influx in homelessness and an increase in crime. During that time period, we had a very large number of fatal overdoses and non-fatal overdoses. And we were kind of forced with a problem where we needed to, find a new solution to tackle that problem. And today we're facing the same thing with fentanyl. Our task force in 2024, we investigated 174 non-fatal overdoses and 18 fatal overdoses. So a big impact on our community as far as what we're seeing.
Definitely. And Sheriff Goodenough, what about in your community?
Well, I'll echo, excuse me, I'll echo the same sentiments as Detective Yoder is. When we had the opioid epidemic hit our community, we had one doctor specifically that I think was highest across the country in distributing opioids here for pain management that was way outside his scope. And that attributed to the problems that we experienced going all the way back to 2015 is when we launched our first initiative to deal with this crisis situation. I will tell you that we continue to trend down. For an example, our total opioid deaths in 2018, I'm just going to kind of give you some quick stats here. 2018 opioid confirmed deaths through autopsy was 39. In 19, it was 33. 20, it was 47. 21, 44. 22, 34. 23, 19, and then 24, 8. So without getting too deep into it, Monroe County was the bellwether case for the opioid settlement funding distribution. And as we go on, I'll get into more of that. We also witnessed fentanyl, and I'm happy to say that our fentanyl deaths in 24 were only 8 as well. That's 8 too many. But keeping in mind, years prior to that, we were in the upwards of low 40s to the high 30s. So again, as we get into this panel, I think I'll be able to share some things that I think has significantly reduced those deaths.
Great. Thank you. We look forward to hearing those things. So as you mentioned, Sheriff Goodenough, 8 is too many. So with that in mind, how do each of your departments interact with people who have overdosed? And sorry, go ahead, Sheriff Goodenough. I'll start with you.
So kind of give you a rundown. Obviously, we're not as big as Columbus. Okay, I have 156,000 people in our community, 564 square miles. They probably have that many people on campus, but nevertheless, we respond to all overdose, whether they're deceased or they're not, along with medical. And we engage them. Obviously, we explain Narcan. We have numerous opportunities for people to obtain Narcan here in our community, which I think is a big contributor to the reduction in deaths. I was the first corrections facility in the state of Michigan to put a vending machine in my lobby with Narcan. The first year, we distributed 980 doses of Narcan out of that vending machine. Prior to becoming sheriff, I was the major of jail operations. We offer to each inmate upon release Narcan. We have numerous places within our community that people can get Narcan. That's one thing. But your question was geared towards interaction. So we respond. The individual hopefully is either given Narcan by medical, use Narcan, but they recover. And we have a very robust MAT program, behavioral health and substance use disorder in our jail that I was instrumental in designing. And as you know, there's many intercepts on the sequential intercept model that talks about behavioral health and substance abuse disorder. And one of the things that I quickly found is we'd go to an overdose, we'd revive them, and historically they'd say, I don't want anything to do with medical, I don't want any treatment, I refuse, and they would go on their merry way. Well, I took and designed an intercept zero model. And with that, when we respond to these overdoses, if they're not a consumer of community mental health, what we do is we do a referral form. It's a one pager. For those of you, I know Detective Yoder will appreciate this. We don't like paperwork, right? And if we put something in place, we have to make it simple and streamlined. So I developed this one-page document that our deputies fill out. And as I said, if they're not a consumer of CMH, whether they are, whether they're not, this goes to CMH, because we all know you got behavioral health and substance abuse. So the question always becomes, what came first? They're co-occurring disorders. We see it all the time. So we took this model, we sent this, so this form, then they complete it in their in-car computer. They automatically send it to our community mental health. Within 48 hours of receiving that document that specifically applies to weekends, most generally during the week is 24 hours, somebody from our community health interaction team will reach out to the individual and work on getting them connected to services and rehabilitation. We know that there will be 8 to 10 times interaction with law enforcement and other people in the recovery community before they may even consider taking some up on some of those offers. So we continue to stay on them and stay active, keep them engaged. And at that time, hopefully we get those individuals into treatment programs. So again, I'll cover some more of that later on, but I think that gives you kind of a high level overview. that we truly care about these people and getting them the help.
Thank you. And Detective Yoder, can you tell us a little bit about how your team interacts with people who have overdosed?
Yeah, absolutely. So, the Hope Task Force, we were founded in 2015. We are kind of unique in that we have like a two-prong approach to this problem, if you will. First and foremost, our goal is investigating the fatal and non-fatal overdoses to ultimately find the source of supply and get a conviction out of that. A win in that area for us looks like a conviction of corrupting another with drugs or even involuntary manslaughter. Um, but our second approach to that, we do call outs for fatal overdoses, and we're on call 24/7 for those. Obviously, our non-fatal overdoses, those are much higher, and sometimes we don't hear about them necessarily when they first occurred, but our patrol will take a report, and then that eventually comes back to us. And what we do with those, we have a working relationship with Southeast Health, and they assign us a social worker. And so we will do twice a week. Generally, we will grab all of our non-fatal overdoses as a follow-up list, and we will go out with our social worker. Obviously, we are there to try to obtain some information about where the source of the drugs are and all that, but we're also there to get them treatment. On top of that, we do outreach events in which we pass out hygiene kits, Narcan, and stuff like that. We the working relationship that we have with Southeast is really awesome, actually, because I mean they can help with getting them into a treatment facility almost like that if they're willing. Clothing, food, transportation, all of that stuff. So that's kind of our two-prong approach. I mean, as stated before, I mean, with these individuals, sometimes you have to have, 8 or 10 contacts before they eventually come around. But it's all about that, knocking, checking up, and just hopefully the time is the time when we knock and they're willing to get treatment.
Definitely. Great. Well, thank you both. You had both mentioned actually that some of these efforts started in 2015 for both of you. Have your departments been involved in other prevention work prior to 2015 in different capacities? And Detective Yoder, I'll start with you on this one.
No, I mean 2015 was about it. Obviously, the drug aspect, narcotic investigation, we've always been doing, but incorporating the resources with our task force to get people care we didn't have prior to. I mean, obviously, if someone were to ask for, care or treatment, we could give them a telephone number or whatever, but we don't know what that looks like on the other end of them calling that number. So with this strategy of having it incorporated, we know what they're going to get when they call that number, or we can call that number for them and facilitate that and make sure that they're following all the steps to receive that treatment.
And how about you, Sheriff Goodenough?
Actually, about the same model. We have our drug task force here, and then flipping back to question 3, yeah, we seek prosecution. We hold those individuals accountable that are selling these drugs that are creating death. We have a pretty aggressive prosecutor and judicial system. But again, very slightly, we did more of an enforcement rather than an education prevention sort of model. And I will tell you that in 2015 is what launched us as we put workshops together with our fellow partners, our judiciary. We held workshops at our college, a day-long event where we brought individual groups in from each of our 9 high schools and talked to them about drug abuse and the effects of drug abuse. As I said, it was a day-long convention, if you would, so to speak. And that's one of the things that we attribute to our success in the declining death rate and overdose rate.
Thank you. So with both of your departments starting around 2015, and you both had mentioned the opioid epidemic as catalysts, were there other steps that led you both up to getting where you are today? And what did that kind of journey look like for your department? And Sheriff Goodenough, I'll start with you.
We started with we found that some of our partners had programs in place to get individuals that were suffering substance abuse enrolled. It just they lacked money prior to the opioid funding being distributed. They lacked funding to send these individuals that wanted help to these outside agencies for treatment. So we held two fundraisers. We had a hockey against heroin fundraiser where we raised, I think, close to $80,000. And that money was then given to the nonprofits to sponsor these individuals in these recovery programs. And again, we just continued holding seminars and community engagement, buying billboards and different things, enlightening people to the epidemic and the opioid epidemic and the results of bad decision making.
Thank you. How about you, Detective?
Yeah, so I obviously I was not a part of the Hope Task Force during its inception in 2015, but I mean it started out with just two investigators then. Now we are a team of 5 with 1 sergeant and 4 detectives, and a lot of our funding is through multiple grants, and we get those grants by producing the numbers that we have, as many contacts as we are making, and really showing that, that improvement of our overdoses going down and our the individuals that we get into treatment going up. And so that's really what funds our group.
Thank you. Sheriff Goodenough, you mentioned doing a lot of community awareness and education effort. So can you tell us some of the larger factors like those community attitudes or local ordinances that have helped or hindered your efforts?
And I'm sorry, I missed the first part of your question.
Oh, yeah. I just asked if there are any larger factors like local ordinances or community attitudes, like you had mentioned with a lot of your outreach and education, that help or hinder any of your overdose prevention efforts.
I wouldn't say the ordinances. We have some of our local communities have developed paraphernalia ordinances to use as a tool to leverage people to get into it, I should say, to get help for their addiction. But for the most part, educating the public and letting that public be a sound voice. We were very fortunate, as I said earlier. We developed boilerplate programs that produce positive outcomes and good return on our investment, as I've demonstrated here. And before I forget, our entire opioid settlement plan that deals with treatment, harm reduction, recovery, and prevention. Those are our 4 guiding principles. And that entire report is available on the Monroe County website, our entire platform and our plan that we developed, how we distribute the opioid settlement funding. And I can tell you, with being directly involved in that, without the community support and input, and that report will demonstrate the strong partnerships that we have from, and Detective Yoder hit the nail on the head. For these individuals to be productive members of society, they have to not only have treatment, they have to have transportation, they have to have stable housing. And you give them those tools. And one of the things that we added to this is, so often they get into the criminal justice system, and then they just continue to be a reoccurring event because they can't pay back their court fines. They get warrants issued for them for failure to appear and different things. So we put their court fines on a payment plan, housing, transportation, stabilization, but continuity of care is critical when they leave, whether it's the correctional institution where we offer, I have a team of 2 clinician and a peer support on behavioral health, and I have a clinician and a peer support on substance abuse disorder. And we put a discharge plan together, and I'm specifically talking about inmates at this time. And we give them a path to success. Now, we all know they don't always stay on that path, but having that continuity of care upon release from jail, which when they're in jail, they're in a position to have nothing but time on their hands. And we find that it works well. In the area of behavioral health, we reduced our recidivism rate by 37% by people with serious mental health illness. And I can tell you that's not a standard met across the country. And we see that paralleling to the behavioral health, or I'm sorry, substance abuse disorder as well.
Thank you. Detective Yoder, are there other larger factors at play for you, whether it be local ordinances or community attitudes that help or hinder your efforts?
So as the sheriff said, we have something here. I can't really speak directly on it. I mean, it is across the street in our courts, but we do have a thing, a drug court, and they offer that for individuals who have lower level felonies. Here, those are our felony fours and fives of like simple possession. And so we do have the ability to, instead of arrest the individual, put a summons out and see if they qualify for drug court. Now that's up to the prosecutor as to whether or not they deem them qualified or not. Obviously, the more serious trafficking and all that, they do not qualify. But if it's someone that's had a lot of possession charges throughout the years, that's something they try to get them into. And like the sheriff said, we have two jails here in Franklin County, and at both of those facilities we have rapid resource centers, and so that's where they can get the Narcan before they leave. There's a lot of pamphlets and just a bunch of resources, and that's really what helps us here in the greater Columbus area. I can't tell you how many resources there are, and it amazes even some of these individuals with substance abuse disorder when they're getting one resource and you tell them about another, and they're like, "Oh, I didn't know I can use both." And so we try to get them to take advantage of everything that you can to get their feet under them. But yeah, I mean, Columbus is a great area, and the community's attitude is great towards stopping this problem. And like he said, both of these things have been formed in 2015, so obviously it's a long time coming. And I think more people are getting on board with trying to help rather than just the normal stigma of someone with a substance abuse disorder.
Thank you. If another law enforcement agency is interested in exploring ways to be more supportive with overdose prevention efforts, how would either of you suggest getting started? See, Sheriff Goodenough, I'll start with you on this one.
All right, thank you. Before I forget, Detective Yoder, I'm good friends with your jail administrator down there. I can tell you he's a great, great man. The operation in those two facilities down there are known nationwide for the programs they have and what the sheriff and the jail administrator have done down there. So they get national recognition at every conference, and he's a great guy, and he definitely cares about the inmate population in his jail. So with that, I meant to say that earlier. They have a lot of great programs out there that reach a lot of great people. And like Detective Yoder said, we have a drug court, a veterans court, a sobriety court, mental health court. It's critical for all them to work in tandem together because, again, we find these courts deal with the same people. But one of the things that I would say is feel free to reach out to us. Go to our website for the County of Monroe and look at our opioid settlement funds distribution plan. Use that. Reach out to us. We have a very robust MAT plan. And you have to look at it holistically. Everybody in the community has to be involved. And you can have great outcomes. And I can tell you, Franklin County is a good example of that. Did we lose him?
I was just gonna say, it looks like we lost Mary. So that's why we have backups. That's why I've been sitting here paying attention. Um, Detective Yoder, do you have anything else to add to this conversation before we move on to the next question?
Yeah, again, I would reiterate, I mean, I would welcome any law enforcement agency to examine our model. And obviously it's imperative to investigate the fatal and non-fatal overdoses from that narcotic standpoint. But the real triggering point that I feel has helped our task force is incorporating that partnership with a local treatment center or social worker instead of, handing them a pamphlet with a number on it, actually having somebody incorporated in your task force. So that way you can, take the steps with them to ensure that they do get treatment and follow up on it.
Absolutely. Well, thank you both for all of that. We have one Q&A question that popped up um, from the attendees. They're wondering if both of you support syringe service programs and why or why not. Whoever wants to take that first. I think that's asking for your personal take on it.
I'll jump in there if you want. So I'll be frank with you. When this first come out, I wasn't supportive of it because I went, are we condoning the use of narcotics? But then when I sat back and I said, well, does that mean I condone Narcan? Because Narcan has a value to it, saving lives. So we have an organization here in Monroe County, Salvation RB Harmer Light, that actually utilizes a grant to pay for syringe collection and distribution. So at the end of the day, I look at that as the doorstep to positive interaction with these individuals. And just maybe through that positive interaction, we can say, hey, we're giving you these syringes because we care about your life. We don't want to spread communicable diseases across our county, which we know can happen with dirty needles. But more importantly, the positive engagement saying, hey, maybe we can take you down a path of recovery rather than you coming here to dispense your old needles and get fresh needles. We can get you into a point of recovery so you don't have to do this anymore. And again, we bring our community into this, right? It takes a village to raise a family. It takes a village to correct a problem.
Thanks for sharing that honest perspective. Detective Yoder?
Yeah, I would agree with that statement. As far as from our office's standpoint, I won't, give that opinion. Obviously, again, because it could be, taken in the terms of promoting the usage. However, so we do not personally, but there are resources out there where they can obtain things like that. And we do provide them with that information if that's something that they would go seek on their own.
Thank you both. Welcome back, Mary. Don't tech issues are always fun. I'm gonna officially hand it back over to you.
Thanks, Miss
And we'll keep
So
the dialogue going.
Yeah, thank you. It sounds like you just got the first question in the chat. So yeah, we are open to some Q&A. So again, to attendees, if you do have a question, you can raise your hand. You can put it in the chat, and there's a Q&A function as well. So I will take a look here. So we have one, how can people approach their law enforcement agencies to build positive connections or relationships around harm reduction? And I'll allow either of you to jump in and answer with these Q&A questions.
All right, I'll jump on there. So yes, we hold community engagement frequently as a sheriff. Matter of fact, I just scheduled, I think about 8 coffee with the cops in the community. So I believe in community engagement. I'm in the community probably 4 out of 5 nights a week at different events, promoting positive relationships. And that goes well beyond just drugs. I always tell everybody as the sheriff, it is my job to write the narrative. And I don't have to tell everybody on this call the blows that have been dealt to the men and women in this career path because of bad decisions by a couple officers. And they have set the tone. And I'll go back a little bit. Post 9/11, we had more people standing at our door wanting to come and work for us than we did. We had jobs. Now we get one applicant for every 60 jobs if we're lucky, and are way down because people no longer appreciate law enforcement. because they see what was published, the bad decisions made by some of our fellow colleagues. I don't really want to call them colleagues, people in our career. So it's my job to write that narrative. It's my job to be in the community. We put community engagement and positive reinforcement at the top of our list. And to the fact that we're building an ice cream truck. I hope to have it ready in the next 6 weeks, that we're going to go into suppressed parts of our community for like 30 minutes at a time and hand out free ice cream to children and young adults that are in our suppressed parts of our community that don't always look positive to law enforcement. I put a school resource officer since I became sheriff in every school district. Some have 2, one has 5, one in every building, to build those relationships. And I actually, this is my personal term, I got away from school resource officer and I call them school relationship officers, because I want those officers to build positive relationships, be a role model, be a mentor, so that when these individuals encompass problems, whether it be drug abuse, bullying, human trafficking, sextortion, that they feel comfortable coming to this officer and saying, I see this, I'm witnessing this, or I have these problems, and feel committed to opening up to that officer. That's the relationships. And we have to enlighten these people. Listen, if you know somebody that's dealing drugs and you're buying them, we may look at alternative programs to not prosecute you, but get us to that, as I'm sure Detective Yoder can appreciate. You get the street level guy and you work it right up. And that's what we want, to build those relationships with these young children that say, come to us when you need help. We're not looking to get you in trouble. We're looking at as a helping hand, a hand up.
Detective Yoder, would you like to add anything to that?
Yeah, so we're always out doing community engagement. I mean, and that looks different in all the different events we do, whether it's partnering with a church to feed the homeless, or going into some of these homeless camps and passing out hygiene bags, toy drives for kids. We do a lot of stuff like that. We try to get our name out there. Unfortunately, our name, it's nice because it's like catchy and people, want to know what it means. Unfortunately, we don't see much of heroin anymore. So in the future, we might have to do some renaming or something, but we're always trying to get out there and put our name out there, so that way we get that engagement and they ask questions, and they know what we're about, and that they can come to us with, their version of a solution, or if they are a church that's wanting to help, a resource that we can add into our arsenal.
Like we have a couple more questions in the chat. So I will ask this one first. So we have a question that says, as a parent who has lost a child to overdose, I'm concerned about the criminal perspective for people using and people distributing. If you agree that mental health and substance use disorders go hand in hand and people deserve help, people often sell drugs for their survival, and they're often just people who have a substance use disorder themselves. So how is charging some of the people who sell drugs with manslaughter or homicide helping them? And why are we criminalizing people doing selling if they also have an illness?
I can answer this one. So in the cases that we have, in terms of we'll do just fatal overdoses and trying to get to that, corrupting another with drugs, or involuntary manslaughter, it is quite obvious to us when we stumble upon somebody who may have sold the narcotics that cause the fatal overdose, that they themselves are a user and they are just selling, to feed their own habit, if you will. And that's, as the sheriff had said before, that's someone that that's not our main target. They obviously got it from someone else. And so we try to work that perspective to keep going up. Now, they can be held responsible for those actions, but that's usually, let's say they gave us who they then purchased it from before selling it to somebody else. That's something we work hand in hand with our prosecutors on. So that way we can try to get them into treatment or something like that and say, hey, they really helped us out with this information of going after the person above them. We we do run into this often, but that's not the end game for us. I mean, that's not case closed. We work beyond them and we try to get that person into treatment as well.
Sheriff Goodenough, would you like to add anything onto that question?
Well, I can't add much more than he did, other than we do charge with delivery causing death. But I will tell you, there's more to that crime, as the detective said, than just saying, well, you delivered this package. We look at their history. We do a full complex investigation with our narcotics task force. And I will tell you, I'm not saying that sometimes are different, that it is someone selling for their mere um, survival and their mode. But I will tell you, the vast majority of them are drug kingpins that distribute a significant amount of narcotics, or did, in our community. And that was not the first time they've sold. And we find that a lot of them are not the users, they're the sellers. They drive fancy cars, they live in fancy homes, and they make a living off the bad decisions being made by some of our individuals that live in poverty and have nowhere else to turn, and they use drugs as a stimulant to get by every day.
Thank you. So we have another question. How receptive are people to working with law enforcement when you accompany social workers for follow-up after a recent overdose?
I will tell you, from our perspective, it is very receptive, because we make it clear to them what you share with them is not of interest to us. Almost kind of like what we do is we preface it with, it's a doctor patient privilege under HIPAA, and we also use it as if it was clergy. It's protected information. So we find they're more open to services. They're all more open to talking about their disorder. And I'm going to kind of go off base here just a little bit. And if you look at when we legalized marijuana, if you look at the HIDA report from California, emergency room admissions went up 400% when they legalized marijuana. Why was that? Because they knew they weren't going to get in trouble for reporting their problem. Take that model and move it to Michigan. Marijuana the same, but heroin, fentanyl, and other opioids. Now that if they know they can't get in trouble, then they're more apt to report it.
Detective Yoder, would you like to add anything about your experience working with social workers when you approach people?
Yeah, absolutely. As the sheriff said, I would say they are more receptive when we have a social worker there, because we do have the ability just to step away, and let the social worker and that individual have a conversation in private. But I will also say sometimes it goes the other way. They may not want to speak to the social worker, but they may want to open up to us. So it is nice having those, two solutions there and letting them choose how they want to divulge the information, or talk about their issues and problems and try to get treatment.
Yeah. Our next question here, there's some context, so I will read it all. We experience quite a bit of encampment sweeps through local law enforcement about weekly that displace many folks. The police let housing organizations know ahead of time to get them into shelter, but we're seeing more and more folks at higher increases of overdoses once they are displaced into a new location. You mentioned, I think this was you, Detective Yoder, but I apologize if not, that you go to encampments and provide resources. Do you have sweep requirements? And if not, from a law enforcement perspective, how would you suggest that we approach law enforcement to advocate to stop encampment sweeps? And they said in Detroit, shelters are overcrowded and there's nowhere for people to go otherwise.
Yeah, so we as the sheriff's office, we do not do the sweeps. In the city of Columbus, I would say they hardly do unless the property is, scheduled to be built on or something of that nature. And even when they do that, they usually, make those aware in the camp that here's this date, this is when it has to happen by, and they do a pretty good job of facilitating getting them moved elsewhere. But yeah, we do not do sweeps. Like I said, we do go down into the homeless camps and try to pass out supplies and everything like that, get them treatment, get them any resources they need, food, shelter, clothing. If a law enforcement agency were participating in sweeps like that, um, my suggestion would be just to go ahead of time, try to make as much contact with the individuals in that camp as you could, and try to find those other means to get them somewhere else prior to, them vacating, and then you don't know their whereabouts, and it may be a worse situation.
Enough. Would you like to add anything to that question about encampment sweeps?
Yes, we don't have encampments that here in Monroe County. I'm not saying that we don't have a wooded area with a tent or two in it that we may not know about. I can tell you just south of our city limits, we do have an area that tends to um, incorporate those individuals around a lake area. And we do go into those. I wouldn't call them sweeps. We go in with our mental health, our behavioral health team. We go in with our substance abuse team. We go in with parole, probation. We go in with resources we have in Monroe County, which is unique to Michigan. We're one of two counties that has an adult infirmary. It's a housing unit that's funded by the county, but you have to meet certain criteria. We go in with that team. Yes, we go in to engage these individuals because frequently they become victims of crime, and some of them become criminal activity themselves, from retail fraud to panhandling to strong arm robbery. So we go in with the idea and the focus of engaging them, getting them the services they need. And you're right, Detroit's full. We don't go in and do these engagements unless we have resources available to put these individuals. We have a fairly good idea how many people's in there, and usually it's no more than 6 or 8 in there when we see them. We give them an opportunity to get resources and move on. And keep in mind, a lot of these are located on private property, and the people say we want them out because they're hindering their business or activities. As I said, one of them's on a man-made lake, and it's as soon as you step off the edge, it's an old quarry. It's 90 feet down, and to prevent them from becoming a statistic, we encourage to get them help. So we just don't move them along just because it's what we're doing. We try to get them services, and we also bring in a team that will get them their Social Security activation and different things. So we give them an opportunity to have income and survive without living in that environment.
Okay. I forget. We have another question. If safe use sites were being considered in your region, would you support those operations?
I guess I'd like a further definition of safe use.
Sure. So my understanding is that a safe use site is a place where people can go to use their drugs safely. And they are, so I think they can be associated with syringe service programs. I might be wrong, but there are places where they might be able to have the support of like a trained professional with administration, just so that they are reducing the risk associated with using. And to the person who asked that question, if that is incorrect, please feel free to send me a message and let me know the additional context.
I'm going to answer the question based on what you provided, Mary. From an ethical and moral standpoint, I can't condone that type of activity because I'm saying, because you're in this room, I'm going to allow you to use an illegal substance in my presence or something. I understand the sympathetic side of this or empathetic side of this, that we put them in an environment where, God forbid, something happens, we can save them. But from a moral and ethical standpoint, I can't pick and choose what laws I enforce. What we can do is we can limit the impact it has on the individual. As Detective Yoder said, we get these individuals, we can surely request for a reduction in sentencing, or not request, I should say, advocate for these folks because they're doing the right things. And if you look at all these specialty courts, that's what they're designed to do. They're designed to do just that. When individuals make progress in their recovery, then you reward progress with case management. So unfortunately, I'm sorry, I just can't condone that type of activity.
And Detective Yoder, would you like to add anything into that question?
Yeah, unfortunately, I'm not really in a position of authority, such as the sheriff. I'm just a lonely detective, so I won't speak on behalf of my department for that question. I will say if something like that did occur, our office would adapt around it because that's what we have to do in these times is just adapt and overcome.
Thank you both. Okay, we have a couple more questions. So continue to the attendees to put any questions you may have in the chat, and we'll wrap up once we are not getting any more questions. But what do you say to someone who is worried about the repercussions of calling the police or other law enforcement to get help with an overdose? And Detective Yoder, I'll start with you on this one if you would like to add anything.
Yeah, so in terms of like if they feel they'll be in trouble if they call law enforcement during an overdose.
Yep, I think that is the basis of the question.
Yep. So we advocate for this all the time. Call 911. We are in a highly populated area. We have some of the best hospitals around. Making that call could save that person's life, and you will not be held accountable for saving, someone's life. If you were also doing drugs with them, we're not concerned with that at all. We've actually had it plenty of times where we've went to a fatal overdose and through means of investigation found out that there was an individual with the person that suffered the overdose, and they had tried things like CPR or Narcan for hours but never called 911, or they decided to call 911 5 hours later after them trying CPR and them trying Narcan did not work. And I tell people all the time, like, you have a better chance of getting in trouble for something like that, the failure to act, than you do calling us. And so I encourage it all the time. I mean, it's devastating, especially since a lot of these individuals that are with someone who suffers from an overdose, their loved ones or a boyfriend or a girlfriend, and they really don't want to see them, pass away like that, but they do fear the 911 call. So we really try to, reiterate, call 911 and save a life.
Thank you. Sheriff Goodenough, would you like to add anything to that one?
I couldn't have said it better if I did it myself.
Great, thank you. It looks like we have one more question for now. Do you have any experiences or stories that stand out to you where you felt like you really made a positive impact on someone or the community as a whole?
Yeah, so I can give one. It's not a crazy one, but I always like to tell people, especially when we interact with them and have conversations about what the Hope Task Force is. So we had an individual call 911 actually on himself. He was using cocaine and he had just purchased an 8 ball. Things were not going well for him. He had just lost his job. And so patrol responded, and here's a guy calling 911 saying, I need help. I have all these drugs, help me. And so instead of patrol, confiscating his drugs and arresting him and putting him into a situation that may not make it better for him, they contacted us. And I'll be honest with you, this is where our partnership, comes into play because our social worker here that works at Southeast, she's phenomenal and she works day and night trying to, help individuals. We gave her a call and she met us out there and immediately started working on trying to get him into a treatment facility. Thankfully, that individual did have good health insurance, but he was in a treatment facility that night, and so we did confiscate the drugs, but he's not going to be charged with them as long as he's going through with his treatment and everything like that.
Great. Thank you for sharing. And Sheriff Goodenough, is there any story or experience that you'd like to share?
Well, I just two things. One, real quick, that we partnered with Hope Not Handcuffs, and we saw the value in that partnership where kind of what Detective Yoder does. We have people come into our lobby, said, listen, I want help. We give them hygiene items and different things of that nature. And then we connect them to Hope Not Handcuffs, which is a third party drug rehabilitation program. We've not had the success with that I was hoping to have, but we have had some success. But the one that really sticks out for me was before I became sheriff. We had a female inmate that was continuously coming to jail. And I happened to get my hands on a picture of when she first came to our facility. She was a very attractive lady. I'm to the point where she could have very well competed in pageants. And over a period of 6, 7 years, her last photo looked like a lady that was about 80 years old and she was only 30. And we kept dealing with her. And finally, I took her booking photos and I put a collage together. And I went up to her when she was in her day room and I said, who is this? And I said, do you know the lady in these pictures? And she put her head down. And I said, who is the lady in photo one? That was the first time I've ever came to jail. I said, who's the lady in the last photo? That's me today. I said, is that the person you want to be? Is that what you strive to be in life? And she says, what do you want me to do? I says, I want you to roll on a treatment program. We have it here at the jail. You're in confined area. I said, you're a captive audience. Take the. She did. And about 18 months after that day, she passed me on the street. I was coming out of our office. She was on a bike and she stopped and she said, hey, Major Goodenough, how you doing? I'm like, good. She says, you don't recognize me, do you? And I said, no, I'm sorry, I don't. And she told me her name. She says, I've been 18 months clean. And she says, I'm working. I have stable housing, stable income. I'm drug-free and I'm back with my kids. That's the success story. That's why we do what we do.
Thank you. Thank you both for sharing. I think both stories just really show the positive impacts that having supportive law enforcement can have on overdose prevention work in our community. So again, thank you. We don't have any other questions that I'm seeing, and I don't see any raised hands. So with that, I will end the panel portion of this opportunity, and we'll provide a legislative update. I'll pass it to Emily Henderson to provide a legislative update. But again, thank you, Sheriff Goodenough and Detective Yoder, for joining today. It's been great to hear from you. Feel free to stay on, or you are free to hop off as well. So again, thank you. Have a great day.
All right, thank you. I'm going to hop off, but I see that you had something mentioned about Medicaid coverage for services provided. We've been, if I could just segue a minute, I've sat on the Michigan Sheriff Association Legislative Committee, and we've been working diligently with Congress to remove the Exclusionary Act, which would basically allow Medicaid and Medicare to continue for pretrial incarcerated individuals. That's a monumental task. That will help with all these MAP programs and behavioral health programs getting coverage. So I just wanted to add that I think we're making headway. I'm pretty confident by the end of this year, we're going to get the Exclusionary Act removed. I'm optimistic, I should say. But things can go sideways. You know how government works. But thank you for the opportunity. And if anything, please feel free to reach out. I love to share our programs if we can help another community. And have a great day.
Thank you. You too. Okay.
Yes, same. Thank you guys for having me and allowing us to participate. Like I said, we're always trying to get our name out there. So anything helps. Then same goes. Any further follow-up questions or anything like that, feel free to reach out to me.
All right. Thank you so much. Have a great
Thank
day.
you. You
Bye.
too.
All right, Emily, I will pass it over to you.
Thanks, Mary. Hi, everyone. Emily Henderson McCall Hamilton. I am the on the ground in Lansing government affairs consultant that works for the MOPC. And we've been working on a number of bills. Some of these are familiar because it's legislation we've been working on for a couple years, but that is the game in Lansing. Good policy takes a long time. And so we know that the political environment is always changing and shifting. And currently we are in an election year for all 148 seats for the Michigan House and the Michigan Senate, as well as the executive branch. And so, we're currently working in a split state government environment. We have a Republican-led House and then a Democratic-led Senate. And then Governor Gretchen Whitmer is also Democrat. And so we are working with our partners, both Republicans and Democrats, on this legislation, and we have been working with them on this legislation for a number of years. But I just want to provide a quick update for all of you that were able to join us today, on the legislation that we're tracking. So you have the bill numbers familiar and in front of you, and also just kind of highlighting, where we are right now in Lansing. So the legislation on the screen, there's just some quick updates for you on what these bills do. We have our House package. That is the package of bills that is once again introduced by Representative Carrie Reingans, who is our House Dem from the Ann Arbor area. She is someone who used to work at a syringe service program when she was getting into the public health space, and she has been a wonderful advocate and supporter of this legislation over on the House side. Similarly, we have introduced legislation on the Senate. This is introduced by a Democratic senator, Senator Rosemary Bayer from Keego Harbor. She introduced Senate Bill 628 and 629. We already had the Senate version of the decriminalization of fentanyl test strips or drug testing strips introduced in the Senate by Senator Irwin, who is also a Ann Arbor Dem in the Senate. And that bill is actually furthest along in the process. That has made its way through the Senate and now waits further consideration in the House and needs to go through the committee process on that side. Our other bills, we are still meeting with and working with our partners in the legislature to push the legislation forward. And, as expected, we are hitting barriers with split state government, but our bills are not unique in this case. We had a record low amount of legislation passed in the state last year in 2025. And seeing it's an election year, that continues to be a barrier for many advocacy organizations in getting policy across the finish line. So currently we are working on engaging with our lawmakers in the district. We are actively working on getting those lawmakers out into their community, having them visit a syringe service program on the ground to see the work that is done, and get our lawmakers to experience firsthand what these programs do. So that is beginning in April. And that will continue throughout the spring and throughout the summer, especially in election year when our lawmakers are spending a lot of time in their districts over the summer months for their campaign season. I know I have reached out to a number of you to set up these visits in the community. If you are someone I have not reached out to but are interested in meeting with your lawmaker, we are always happy to connect you with that individual, come out to the district with you, and help engage with those lawmakers on the ground. So again, just quick highlights on kind of where we are in Lansing. But our focus right now is going to be that on the ground approach in bringing lawmakers out to those syringe service programs and having them see all the work that is done, and all the great work that you do to keep people alive and get people the resources they need to, have sustainable lives out in the community.
Thanks, Emily.
I do see some questions, so I'm happy to address those. So SB 399, the decriminalization of fentanyl test strips bill, yes, that has passed the Senate, and that is now waiting further consideration. I believe it's in House Judiciary. So we are working on meeting with our committee members in the House to push this bill forward and hopefully get it moving through the House so we can see some success on one of the two big bills that we have been following and working closely with our partners on. And then is the test strip decriminalization bill, does that include drug checking language? I do not believe that has drug checking language in that legislation, but I can double check And I am happy to follow up with you after the call. But I believe this is just the decriminalization of the drug testing strips that get distributed out to individuals in the community.
Thank you. I don't see any other questions, so thanks, Emily, for providing the update.
Absolutely.
And that brings us to the end of the webinar today. Thank you so much to everyone who joined. We did record this session and it will be included, the link to the session will be included in a follow-up email to everyone here and to all who have registered, and we'll also post it to the MOPC website. So you will be able to see it again if you'd like, share it with people who may be interested. But if you do have any questions, you can email the email info@mioverdoseprevention.com. But with that being said, thanks again for everyone joining today, and I hope you have a great day. Thank you.